Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through innovation, leadership, and lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine and serve as Chief Medical Officer of Nudge Health. The future of healthcare isn't being written in policy briefs or press releases. It's being written by clinicians who dare to prescribe differently, by leaders who rebuild systems from the ground up, by patients who reclaim their health when someone finally gave them the right tools. Each episode of Flip Your Script brings you 5 key takeaways from the people living that story, because the best way to change medicine is to hear from those already doing it. In this episode, we are honored to be joined by Dr. Alicia Craig Rodriguez. Dr. Alicia is a board-certified family nurse practitioner and leader in integrative health, academic innovation, and lifestyle medicine. At Florida State University's College of Nursing, she serves as clinical professor, entrepreneur in residence, and Jonas Nurse Leader Scholar, where she leads initiatives that unite clinical excellence, evidence-based practice, and educational transformation. Alicia began her nursing career in 1992, working across hospital, community, and clinical research settings. Over the next 15 years, she rose to executive leadership in pharmaceutical drug development, contributing to the creation of novel therapies for both acute and chronic diseases. In 2013, she returned to primary care with a renewed mission to help patients achieve optimal health by identifying and addressing the root causes of chronic illness. Her clinical interests include chronic disease prevention and reversal, hormone optimization, and personalized lifestyle interventions. As creator and coordinator of Florida State University's lifestyle medicine programs, Alicia pioneered the nation's first full academic pathway to professional certification through the American College of Lifestyle Medicine, a groundbreaking model now serving as a national exemplar for nurse practitioner education. She also practices at the FSU Lifestyle Medicine Clinic, a faculty-led teaching practice integrating functional and lifestyle medicine into patient-centered care. Alicia is a diplomat and fellow of the American College of Lifestyle Medicine and is currently pursuing advanced certification in functional medicine through the School of Applied Functional Medicine. Welcome, Alicia. How are you doing today?
I'm doing very well, thank you. It's so nice to be here. Thank you for having me.
Thank you. It's my pleasure. So let me start by asking a question about where you are. So I know you've had a remarkable career spanning bedside nursing, pharmaceutical leadership, and now lifestyle medicine. Can you take us back to the moments or series of moments that first drew you into lifestyle medicine and made you rethink how healthcare should be practiced?
That's such a good question. And when I think about that question, it wasn't a single moment, but I think it was a series of moments that really brought me to where I am today. And I've had, as you mentioned, a wonderful career in nursing. Started at the bedside, worked as a home health nurse in the community, somehow found myself in pharmaceutical drug development and research. And at that time, it was a wonderful step for me because it really helped me to understand how medications can be life-saving. And I spent a good 15 years in that area and slowly over time developing increasing responsibilities to the point where I was leading a very large national organization in that drug development realm. We developed all of the medications that are now on the market, very important medications that are life-saving and so very important. But I reached a point over those 15 years where, I think all of us reach a point in our lives where it's time to sit back and reflect.
Yes.
And for me, I was at a place where I thought, I have done some wonderful things. I'm in a very good place. but where do I want to be in the next 20 years? And I've always been someone focused on my health. My own mother died at the age of 59 from what I would say was lifestyle related
Mm-hmm.
cancer.
Yeah.
And so it's always been very near and dear to my heart to really help others to thrive in their life and to be healthy for as long as possible. And so at that time, when I was reflecting, I asked myself, uh, what is my legacy going to be? When I retire, whenever that may be, I don't plan on retiring anytime soon, but what legacy do I want to leave? And as a nurse, and my nursing career has been very good to me. I've had so many wonderful opportunities to impact others through what I call that ripple effect.
Yes.
At that moment, I knew that although I was, in a good place career-wise, very comfortable, if you will, it was not something I wanted to continue because in my heart, I knew that medications are important, but they're only one approach,
Yes.
one tool in the toolbox, as they say, right? And so I knew that as someone focused on my health, the health of my own life and my family, I knew that it was a great time for me to pivot. And I've always been someone who feels comfortable stepping out of my comfort zone. Thankfully, I think that has been very helpful for me in my career. And so I was at a place where I knew it was a good time. All of my colleagues, of course, thought I had lost my mind because, not too many people, will just
Yes.
literally pivot 180 degrees, which is what I did. I was an expert in my field at that time, and by pivoting, I had to become a novice again. And so I returned to graduate school, where I, you know, enrolled in the Doctor of Nursing practice program, and I became a family nurse practitioner. Now, I had not had direct patient care in a good 15 years, so it was literally starting over.
Yeah.
And so I took that opportunity in my training to really focus on lifestyle, health promotion, and disease prevention. And while my program was extremely rigorous, it's not an easy program for me. What I did realize retrospectively was that what I learned in graduate school, to be a nurse practitioner, was that it was focused on the sick care model.
Yes.
Where you look at the symptom, you create your diagnosis, and from that diagnosis, you decide which pharmaceutical intervention would be appropriate. And there was very little spent on any lifestyle interventions. And so I knew that, and of course, as soon as I, became a nurse practitioner, I was called back into academia, where I wanted to educate, inspire, and empower the next generation of nurse practitioners. So when I was there at Florida State University, I was fortunate enough to have an opportunity to broach the subject with the academic leadership team about starting a new program. And as the entrepreneur in residence for the College of Nursing, that was expected of me to innovate. And I remember standing up in, our monthly faculty meeting, and at the end, there's always anybody want to talk about, something they want to, develop. And I stood up and I talked about my vision about creating a lifestyle medicine program. And at that time, I had just learned about the American College of Lifestyle Medicine because what I was looking for, I found, although it was a medical residency program through ACLM, as you know, and love, but there was nothing for nurse practitioners at that time. And so I knew that was what I wanted. And again, physicians and nurse practitioners work side by side. They work as a team. We're all in this boat together, right? So I wanted to create something that would be very similar because that is the future of medicine. And so I stood up in the meeting, and when I talked about the vision, you could hear a pin drop. It was very quiet. And I thought, oh my goodness, maybe this may not be the right time. But I was very pleasantly surprised because we had the right leadership team in place looking for opportunities to really make our program better. And so that was 4 years ago. And actually, maybe a little bit longer than 4 years ago, we launched two programs. The Doctor of Nursing Practice in Lifestyle Medicine, specifically designed for nurse practitioners already in practice, already certified, who wanted to take their practice to the next level. The second program was the Postmaster's Certificate in Lifestyle Medicine for any healthcare professional who also wanted to get additional training. And so this was really an alternative to maybe some of the other programs out there. But as of right now, the program is thriving. We have a 100% pass rate for the ACLM certification exam. I have been so fortunate to have so many key colleagues at the American College of Lifestyle Medicine who have really provided not only me, but all of my students with the tools for success. And so shortly after that, about 2 years ago, we grew the program even more by opening up a dedicated lifestyle medicine clinical practice. So we do primary care, lifestyle medicine, functional medicine, and it is a living learning laboratory for our students. So we are now in our third cohort of the LEADER program for diabetes remission, and you know that program very well.
Absolutely.
It has been life-changing for our patients. And so we're not only educating our students within this clinic, but we're educating our patients in a way that they've never been educated before. And so it's very fulfilling for me, and I am so happy that I did pivot when I did.
Yes, and I really admire your journey. It's been very impressive for sure. But I want to highlight on the pivot that you really talked about. So after years in executive leadership and drug development, you made a deliberate pivot back to primary care with the focus on root causes. What benefits or assumptions about chronic disease did you have to flip as you made that transition?
Well, I think having the experience in drug development has really helped me to shape my thinking, because I do have a deep, deep respect for medications. I think they're appropriate in certain situations, but I think we rely far too heavily on medications. And when I looked at my own family, when I looked at my friends, my loved ones, very often individuals find themselves in a place where they're taking multiple medications. They don't necessarily know how they work. They don't necessarily know why they're taking so many and whether they need to continue to take so many. And so I just looked at it as an opportunity to really make a difference. Chronic disease, being an executive allowed me to kind of take a higher level view of the healthcare landscape and environment. And it was very clear to me that we were going in the wrong direction, and that all of these wonderful medications were not changing, were not moving the needle at all. If anything, our chronic disease was getting more complicated and growing. And so I knew that it was time, and I knew that I could make a difference. Given my love for the 6 pillars, which I have tried very hard in my own life, my own personal life, to follow. Although I'm not 100% there, I'm not perfect, but I do think that it was for me just once you learn it and once you see it, you can't unsee it. If that makes sense.
That is so powerful. Yes,
I could not ignore what my heart was telling me to do. And, it was a perfect opportunity because my children, were leaving the nest, and it was that perfect time to say, all right, if you're going to do something different, this is the time to do it.
Yeah, really well said. So let's talk about the academic pathway. I know you helped pioneer the nation's first full academic pathway to ACLM certification for nurse practitioners. Tell us if you had to encounter any resistance or skepticism along the way, and how did you reframe those challenges into momentum for the real change that you were seeking?
Great question. I encountered quite a bit of resistance
Mm,
from my own faculty colleagues, and actually, I'm thankful that they did, challenge me because
yes.
I think the program is successful in part because of those challenges. Asking the question, how do you think this is going to, in any way, improve, care? We
Yes.
already have, four other programs. What are you going to do differently? And so, and the bigger question was, how do you know that nurse practitioners are going to want this program? And
Mm,
so, again, all of these questions really helped to galvanize my thinking. And I actually developed a needs assessment, which I would strongly recommend for anyone looking to develop a program like this in the academic setting. And I was able to send a survey to all licensed nurse practitioners in the state of Florida.
mhm.
And I didn't do it nationwide. I started with Florida, and the response rate was phenomenal.
Wow.
And the largest percentage of respondents actually said, if you develop this program, I would be interested and I would enroll in it. So I had the ammunition, or the evidence, I should say,
Right.
to take this to the highest levels of the university to say, not only is this needed, but we have individuals who are ready for this. And as they say, timing is everything. And so, we had to do a lot of digger um, deep diving, I should say. We had to do a lot of research in the community.
Yes.
The stakeholders, are the providers in the area open to lifestyle medicine for our students, for example? Is the hospital also, an environment that is conducive to having our lifestyle medicine students come in? And so it was just doing a lot of research that strengthened, I think, the program, so that
Mhm.
when we did launch, it really, it was successful from the very, very beginning.
Very
So
well said. Yeah, well, congratulations on that
thank you.
remarkable work that you led. So you really work at the intersection of lifestyle medicine, functional medicine, and positive psychology. How has that integrative lens changed the way you think about success, not just for patients, but for clinicians and educators as well?
Well, I have a lot of conversations with my students,
Hmm.
and what I hear from them, and this I think really answers that question. Not only are we changing the lives of our patients,
Hmm.
and these are active nurse practitioners in their practices, so they're taking those tools and they're using them immediately while they're
Hmm.
in the program. But I think the biggest change I've seen is in the students themselves. I'm hearing things like, I have completely changed my lifestyle
Yeah.
since I've been in this program. I have changed the way I eat. I have changed the way I show up in my practice. And so I think that what we're doing is we're really changing uh, patient care one individual at a time, but we're also changing the future provider workforce. And
Yeah.
that, to me, is so vital, because we know that right now the current landscape is very challenging. And so
Yeah.
if we're going to prepare the next generation of nurse practitioners and healthcare providers, we have to equip them with the confidence,
Hmm.
the competence, and the tools, so that they can be successful, whether it's a 15-minute visit or an hour-long visit. We need to be able to do that.
Yes, yes. So, in closing, let me ask you, for nurses, nurse practitioners, and health professionals who feel stuck in systems that don't support upstream or a lifestyle-based care, what's one script they might need to rewrite in order to lead meaningful change, no matter wherever they are? So, what advice do you have for them?
Well, I think the very first piece of advice I would give is to not be afraid to step out of your comfort zone, because we know that that is where all innovation begins.
Yes.
All growth happens. And so sometimes it takes an individual to be okay with being uncomfortable in order to really make that change. I also think that we need to redefine healthcare. And, for those of us who are in the trenches, we know that the current model is not working. So any little steps we make, any encounter we have with a patient is an opportunity, whether it's giving them one little tool or giving them, a whole large bucket of tools. Anything you do in practice is going to change the way the patient thinks about their health. And we do know that right now, most patients are used to the expert model, not the coaching model. And so we have to be able to take off our expert hat and stop telling. And we need to start really sitting back and listening and really getting to know what the patient really needs. And we need to give them those tools to be successful. And the coaching model is not something we learn in advanced practice. I don't think even in medical training. And that is the only way that you can empower your patients, because, you can scare them a little bit, tell them that, this is going to happen if you don't go down this path. But if they really understand the pathophysiology, which is what we've been doing in our leader program, helping them to understand what is underlying, their chronic disease, the cardiometabolic problem. They really understand now why they have to make this change. And it's not just telling, it's helping them to learn about their body.
Yes, well said. Yes, it's a coaching and really meeting patients where they are. So thank you, Alicia. I think you've given our listeners a real sense of what's possible when we're willing to think outside the box. Thank you for your leadership, your time, and your insights.
Thank you so much for having me. I really, really appreciate it.
Yeah, and thank you to our listeners. Keep asking the questions others aren't asking. That's where change starts. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected for more conversations with clinicians, policymakers, and innovators rewriting the rules of health. One policy, one patient, one bold idea at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.